Honorable Ablakwa, good morning, and thank you very much for joining us.
Well, good morning, Winston, and thank you for having me.
So, we've been on this issue over the past week. We know that NADMO is in there. You are there yourself. The Ghana Armed Forces is helping. Tell us what the situation is today and how your constituents who've been affected by the spillage are coping.
Well, good morning to you. Good morning to all listeners. Winston, sadly, I will have to confirm that the situation is still dire. The water hasn't receded. On the contrary, the VRA spillage continues. And so a lot more communities are affected. And last night we had to evacuate few more communities in addition to the 23 earlier communities we had to evacuate. So new shelters have been created. I was with them last night at the Fojoku Basic School where we have our latest shelter. And there's another shelter now at the Dofo Adidome Basic School. So we are creating more shelters. More evacuations have had to be carried out because of the continuous spillage. Then I must also inform you, Winston, that a number of communities are now cut off entirely. Yesterday, I could not use the Joapong Adidome Road because the Ngolipe Bridge has been submerged. And so those who know that stretch through Joapong, Volu, Batotogodo, Mapatogodo into Mafia Didoma, and then you can use Sugakopa. I couldn't use that route because of the current situation. So technically, about half of my constituency has now been cut off because of the rising water levels. So it's a really critical situation, and we would have to increase our interventions to support thousands of people who are now displaced, who have lost property. There is no schooling because most of our schools are now being used as shelters. A lot of chiefs compounds have been submerged, so there's lack of access to health delivery. A number of our health workers are also now homeless. Yesterday we were trying to get new accommodation for nurses whose homes have been submerged. So the situation is really dire, and I wish I could have told you this morning that things are getting better, but that's not what is the case.
Now, one issue that you've talked about is the fact that a lot more communities are becoming affected. And today, one of the papers has reported that about 6,000 people have been displaced. For us, the other point is, these persons, are they okay? What is it that they need? And have they been provided with the things or that they need to at least be okay?
So clearly they are not okay because we are creating this makeshift camps very rapidly. So what we are doing this afternoon, I am launching this MP's mobile relief caravan. We have been able to mobilize quite a number of food items, rice, maize, oil, canned fish, and other personal effects, like sanitary towels, tissues, soap, other detergents, and all of that, which we will be distributing to all these camps from 1 p.m. today. We also observed last night that we will need a lot more tents. We will need a lot more mosquito nets because you can expect that because these are open air camps, mosquitoes are having a field day, and we don't want malaria to add on to the already distressing situation. Then I can also confirm to you, Winston, that I have forged a very great partnership with the Ghana Medical Association. So tomorrow we will be carrying out medical outreach because the looming danger is a health crisis. The water has gotten into all kinds of places, cemeteries, toilet facilities, sewage, and all of that. So the water is contaminated. And remember that has been the source of, cooking, some even drink against our advice and all of that. So the fear is that those who continue to trust this water, we may have a cholera outbreak, a typhoid outbreak soon. So that is another fear we have. So we are collaborating with the Medical Association to see how we can carry out outreach, do community sensitization, public education, and see how we prevent that. But immediately, we need a lot more food, a lot more blankets, a lot more mosquito nets, and medicines. There are some of these senior citizens who have lost their medications. So even though we've reached out to some pharmaceutical companies and have secured a few, it would be great if we receive more medicines because a lot of the vulnerable senior citizens and children have lost access to their medication. And if we do get these medicines, it will go a long way to keep our people alive.
This morning I'm joined by a member of parliament for North Tong, Samuel Okduzeto Ablakwa. We're having a conversation about persons displaced as a result of the spillage of the Akosombo Dam and the help that these persons need. We're finding out how they're coping. And Honorable Ablakwa, you've talked about, the need for blankets, mosquito nets. You've talked about food, medications. We know that NADMO is in, the district, and NADMO, they tell us that together with VRA, they're doing lots of outreach and they're helping these people. Are you in touch with them? Have they been able to supply all the relief items they promised they're going to supply?
Yes, I've been in touch with NADMO. The Director General was here himself. He led a high-powered delegation, and together with the Deputy CEO of VRA, we have talked about the needs of the people. They did bring some initial support, rice, oil, and promised to bring a few more items, particularly mosquito nets, the tents, and all of that. So far, I think that they are still mobilizing. Let me put it that way. They are still mobilizing. It does appear to me that NADMO is quite overwhelmed. So I would not suggest or recommend that we entirely depend on NADMO. It will be great to have corporate Ghana, to have NGOs, other philanthropists come to our aid, because it's quite a massive situation from North Tong all the way to Central Tong, South Tong, Ada, the Sojaman constituency, so all the way to Anglon, Keta. So even though we are the worst hit in North Tong because we are closer and we are really low in terms of our topography, there are still many more communities who are in dire need of help. So it does appear to me that NADMO is overwhelmed at the moment, and if we can have national mobilization, a lot more people, a lot more organizations jump on board, and we form a strong coalition, I think that it would really help to save lives.
So, talking about strong coalition to help save lives. Finally, what are some of the things that the people need that all of us can come together to help them, to help provide for the people? So currently, what are the most pressing needs? So we all come together, beginning today, to help the people of North Tongue, South Tongue, and Central Tongue, and all those who've been affected.
So pressing needs in order of priority, I'll say food, number one. Number two, medication. Number three, shelter, that is blankets, clothing, mosquito nets, mosquito coils. So these are the urgent things. And then because the water is contaminated, and we have urged them to stay away from the water from the lake, we will also welcome a lot of water support. So these are the items needed urgently. A lot of food, rice, maize, oil, plantain, yam, any food you can lay hands on, it will go a long way, because we have hundreds of camps, of shelters across the entire, banks of the river. And the more we are able to rush in with these things, fortunately, so far we have not recorded any casualty. Nobody has died, and we pray that we are able to keep it this way, so that we do not have a situation where after people have been rescued, they probably die out of hunger or lack of medication. That would be really, really tragic.
Okay. Well, like I stated this morning, for us as the Super Morning Show, we are of one belief that whatever happens in this country, anywhere, affects all of us. And we've been to the north. We did the Up to Us campaign. We went to the southern part of the Volta region, the Anglo areas when they were affected. We want to assure you that we'll work with you and your team in ensuring that we're able to mobilize a lot of relief items for the people of your constituency and other constituencies who've been affected. This will just be the first of many conversations to come, as we also reach out to corporate Ghana and to make sure that the people who've been affected by the spillage are better and get the right relief. Thank you very much, Honorable Ablakwa.
We are very, very grateful, Winston, and God bless you and the team at Joy. We are grateful.
Thank you. So that's the Member of Parliament for North Tongue, Samuel Okduzeto Ablakwa.